Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Bone tumors. So the first one you're looking at is the chondroblastoma. Chondroblastoma histopathologically it has a chicken wire appearance. So chicken wire appearance is seen. Then when you look at the X-rays, the X-ray is there is small. It is small as well as it is a circumscribed lytic lesion. Circumscribed lytic lesion is seen. Then it involves also the epiphysis. Next, you look at the aneurysmal bone cyst. So aneurysmal bone cyst, there is a presence of the soap bubble appearance, and the MRI we look for the blood fluid levels. Then moving on to the simple bone cyst. This is has a fallen leaf, or it is also known as a teardrop sign. This is in the proximal humerus, and this is nothing but the MC site. That is the most common site. Then we move on to the osteosarcoma. Osteosarcoma is nothing but the sunburst appearance is seen, and this is nothing but the periosteal reaction, and this is with the osteoid formation. This was the osteosarcoma. Then moving on to the osteochondroma. Osteochondroma, there is a bone overgrowth or is continuous with that of the cortex, and which grows away from the joint line. Next, the cartilage cap is present. It is present, and if larger than 2 centimeters, if case it is larger than 2 centimeters, then consider the malignant potential. Next, if it is larger than 2 centimeters, we discuss it as a malignant potential. Then multiple osteochondromas, if known as hereditary multiple exostosis or diaphyseal achalasis. Now we look at the osteoid osteoma. It is the cortical-based cortical thickening, and there is a central nidus is present. It might lead to severe night pain. Then we look at the enchondroma. This is nothing but a lytic lesion involving the small bones of the hand, and it is stippled calcification, and this is present on the X-ray. Next is the multiple enchondroma. This is nothing but the Ollier's disease. The enchondroma is there is hemangiomas and the Maffucci syndrome. Then comes the chondrosarcoma. The chondrosarcoma, it grows beyond the bone, involving the flat bone, grows beyond the bone and involves the flat bone. Next is the popcorn calcification. The popcorn calcification is along the end osteal scalloping, and it is seen in terms of the elderly. This is the chondrosarcoma. Then the secondary bone tumor metastasis. There is a vertebral metastasis. This has nothing but the winking owl sign. Then moving on to the fibrous dysplasia. This has the dysplastic bone with the fibrous matrix. Next, there is also the ground glass matrix. Ground glass matrix is present. The femur is there is a Shepherd-Crook deformity. Shepherd-Crook deformity is also present. Now moving on to the Scotty dog appearance. Scotty dog appearance is seen in case of the spondylolysis. This is seen. Then the beheaded Scotty dog. The beheaded Scotty dog is seen in the spondylolisthesis. Now, the normal Scotty dog appearance formed by the normal Scotty dog appearance, if you see, it is formed by the superior articular processes, the inferior articular processes, as well as the neck of the pars interarticularis. Now the frontal view is with the severe L5S1. So it is with the severe L5S1. And this is a spondylolisthesis. And it is an inverted Napoleon heart sign. Inverted Napoleon heart sign. Next is the shoulder hip dislocation. Then comes the normal X-ray. The normal X-ray. It shows the overlap of the glenoid, and also the humerus. Overlap of glenoid and the humerus head. And this is with the crescent and the half moon shape. With the crescent and half moon shape. So in the posterior dislocation, there is no overlap and no crescent sign. So posterior, there is no overlap or a crescent sign. The humerus, it resembles a light bulb. Light bulb, what is it? It is a humerus. Next, the anterior dislocation of the hip, it shows flexion, adduction and external rotation. It is known as a Faber. This is the anterior dislocation. Faber stands for the flexion, abduction as well as the external rotation. Then posteriorly, it is known as a Fader. Fader stands for the flexion, adduction and the internal rotation. To learn and grow daily like this, please do subscribe.